Shot? Okay, welcome to Deuk Joint Institute, Deuk Spine Institute. Our patient is having a bilateral piriformis muscle release. The piriformis muscle runs from the tailbone over to the top of the hip. Let's pull the fluoro out for just a minute so we can show the audience. Now this patient also had the Deuk laser disc repair and the Deuk plasma rhizotomy done for facet pain. Now we're going to do her piriformis releases. We diagnosed her with piriformis syndrome. She had severe tenderness in her buttocks. She's had it for a while. That just doesn't go away. These tears never heal. We've done shots, we've done Botox, we've done PRP, stem cells, therapy. And in the end, these patients always get referred out for what's called a piriformis release, where the surgeons typically will cut through the whole gluteus maximus, medius, and then finally the piriformis is way down there. It's a very painful procedure, very bloody, and a lot of times they don't even cut the right muscle. So I pioneered a new way to do this. It turns out the safest and easiest place to do the release is right at the hip, and specifically where the greater trochanter is and the posterior tubercle. All right, bring the fluoro in. We're going to use X-ray guidance to do this. And where do we inject? There. Shot. Let's get south. So the first thing we're doing is AP fluoro. And did we change something? Shot? I guess it's here. Shot? All right. What do you think, Davis, there? I like it. Yeah. Now I made a 4 millimeter incision. I'm going to navigate down to where the muscle attaches to the hip. Okay? And I'm going to release this piriformis muscle right off her hip. That's the easiest and safest way to do this. Shot? So the first thing I like to do is I like to dock my probe right on the bone. Just got to get there first. Shot? So we're navigating down, a little bit too lateral. We redirect. Shot? To superior and lateral. Shot? To superior. Shot? To superior. So I'm making small corrections. Shot? Medial. Any questions so far? There's the bone. It's too superior though.
No current questions, but we do have a comment. It comes from Michael on Facebook saying, good morning, Dr. Deuk and team. Have a great day of surgeries. We have missed your live streams. Working my butt off to get the DLDR. Can't wait.
Thank you, Michael. Appreciate it. And yes, it's damn good to be back. I could tell you that. Shot? All right, shot.
Oh, we have another question.
Sure.
Coming from Mohammed on YouTube.
Yes, Mohammed.
Asking, what is the purpose of this surgery?
The purpose of the surgery is to get rid of pain, to eliminate back pain. Shot? And the pain that we're getting rid of, Mohammed, is pain that comes from a muscle in the buttock called the piriformis muscle. There it is, right there. Okay, and this muscle, once you tear it, it's a little slippery. Shot. All right, perfect. That's the perfect spot. Once you tear this muscle from bad biomechanics of your body, basically what happens is you get hurt. Like you have back pain, right? And then you stop bending and moving properly. You bend improperly. You're trying to favor your back and not hurt it. So what patients do then is they end up tearing the muscle in their buttock, tearing it, literally tearing it. And once you tear it, it never heals. We've been treating this condition for many, many years, and it never heals. And the patients just have pain in their buttock for many years, the rest of their life, actually. So we end up sending our patients to have open piriformis muscle release by the surgeon, the orthopedic surgeon. And a lot of times they come back and they're still having pain, the same pain. But it's worse even because they have to cut a big cut in the muscle. And so we decided there must be a better way, but there wasn't. And I pioneered a better way by actually making a small incision and using minimally invasive technology to release the muscle. All right, let's see where that is. Shot. That's high enough. And I feel the bone. The key is the relationship of the muscle to this greater trochanter. If you understand that relationship, then you can fix the problem surgically. You can hear the muscle fibers. They're like a guitar string when they're cutting. All right, that should be on the posterior neck. Let's see, right here, shot. Shot. I feel the posterior neck. So far, so good. I hope that answers your question, Mohammed. Fortunately, there's nothing that you can really hurt in this area. It's a pretty safe area to work surgically. It's very difficult to do any damage. There's not much here. All right, and you've got to feel the bone. That's the key. Shot. If you're not feeling the bone, then you could be somewhere you're not supposed to be. You don't want to do that. So I feel the bone, but I'm finding the right spot on the bone, and I'm just making sure that we did everything properly. Shot. Right? I don't feel any more attachment. I think we got it. Let's get another one. I'll put pressure. All right, we're done with one. You guys want to see the incision?
Yes, we do.
Pull back for a minute there, Jordan. You guys take a look at this incision. So the whole procedure is done percutaneously, and the incision is here. You guys see that?
Yes, we do.
It's literally 4 millimeter, 5 millimeter in this case. That's why it can be done outpatient, very safely. There's a little soreness in the buttock from the procedure, which goes away by the next day. All right, let's get the other side done. Shot. That's perfect. And are we rotating the hip?
Yes, sir.
Shot. Thank you, Dr. Davis. Perfect, right there. We'll make a small incision. I use a number 11 blade scalpel, which is perfect for making a 4 or 5 millimeter incision. And normally if we just do this procedure, it literally takes about 15 minutes per side. So shot. Today we did a lot more than just this procedure. We did the Deuk laser disc repair, which we did earlier. And we did the Deuk plasma rhizotomy. There's the back of the greater trochanter. I could feel it. You have to feel the bone. That's the key here. Shot. So I feel it right there. And that's the bottom of where I want to start my release. I want to move my way up from there. Okay?
We have another question.
I'll take it.
Coming from Mohammed once more on YouTube, asking, so how would I know if I have this issue and I need this treatment?
You need to do a Zoom with me, or you need to have me examine you. Me as in Dr. Deuk. You need to have Deuk Spine examine you. Our doctors are capable of making the diagnosis. But basically, it starts with pain in your buttock. Pain in the top of your buttock. Okay? So if you look at your butt cheek and you touch the middle, the center at the top half center, and it's sore, you have a piriformis syndrome. And of course it can be confirmed through an ultrasound guided injection of the muscle with steroid and numbing medicine. And if that takes your pain away, then you have piriformis syndrome. Shot? So you can go to a pain management physiatrist where you live, ask them to do a piriformis muscle block, and if that takes your pain away, that's what you have. They will not be able to permanently fix it. We can, so you come here and we fix it. This is how you fix it. Very safe, outpatient, easy to do. Tolerated very well by the patient. I think that should be the posterior neck. Let's see. No, there's the posterior neck. All right, done.
Sitting down, please. Thank you.
So we did the bilateral piriformis release. We did the DLDR and the DPR. Staple? Okay. All right, you can terminate the broadcast. We're done.
Copy that.